That is the topic. Next topic, our hypercalcemia. You can clearly see. First of all, when the patient is coming, so what are the calcium level? Normal level is from 8 to 10 or 7 to 10. Okay, so that's a calcium level. And calcium is more than 10. Okay, so I have make a mnemonic. I have simplified a thing. If the calcium is from 10 to 11, 11 to 12, 13 to 14, and more than 14. Okay, it is not given here. So write down in your notes. Okay, so if the calcium level is more than 40, it will be always due to malignancy. It will be always due to malignancy. We will discuss them. Okay, like you can say the lung cancer can cause that. There are multiple things that can cause hypercalcemia. That term use hypercalcemia malignancy. If it is from 10 to 11, it can be due to albumin. Okay, it can be due to albumin or just due to dehydration. Okay, and these 11 to 12 and 13. So these causes most commonly it will be due to hyperparathyroidism. So just by seeing these levels, you can just little bit interpret. Okay, most of the time it is more than 14. Always remember it is malignancy. Okay, if it is like 10 to 11, 11 to 12, it can be diuretic. Okay, 11 to 12, it can be diuretic most of the time. If it is like in upper higher level, it can be hyperparathyroidism. That's it. Now is study the topic. When you are having hypercalcemia, repeat the test, check for albumin correction. Then here is a question, guys. If patient comes with hypercalcemia symptoms like stones, bones, scattering over tones, constipation like that, these symptoms, examiner will ask, what is the next best step? So your first next best step is measure the PTH level. So that is important. MCQ. Okay, remember that if patient is coming, if the patient is coming with hypercalcemia, what is the next best step? Mark your point. It is PTH level. Okay. So if the PTH is done, if the PTH is high and elevated, so it cause can be hyperparathyroidism. Okay. Okay. You have to remember all these causes, but remember high yield cause always. Okay. So most of the time I have seen students in trying to memorize all, they forgot all. Okay. So remember, here's my humble advice. Okay. Okay. Remember the high yield cause first. Okay. Okay. So in this case, high yield cause is given in the, you can see bold letters, primary hyperparathyroidism. Also, it can be due to familial hypocalciuric hypercalcemia or lithium. But this, for me, this is important cause, the first one. Okay, in this case, PTH will be high if the PTH is low. Okay, so next, what is the next best step? So again, if the PTH level is given, it is decreased. Then examiner asks, what is the next best step? Okay, always measure these levels. Measure vitamin D. Okay, okay, 25 vitamin D, 125 vitamin D. I measure PTHRP. Okay, so remember that. If calcium is more than 14, okay, directly measure the PTHRP. PTHRP. So that these are the important MCQ. In step two is, believe me, nothing different from step one. What is different from step one? You have to follow the steps. Okay, what is your first step? What is your next step? Then next. Okay, that's it. Otherwise, step two is just similar to step one. Okay, here, if patient come with hypercalcemia, next best step, PTH level. If PTH is given, calcium is given. What next step? Okay, so if the PTH is low, what is the next best step? See the calcium level. If the calcium is more than 14, go with PTHRP. If the calcium is around about 11 to 12, okay, go with, you can see 125 dihydroxy vitamin D. Okay, if the if the, you can say calcium is much lower, you can go toward 25 hydroxy vitamin D. 25 hydroxy. So I'm repeating again. If the history focuses like malnutrition, like that, okay, dietary disorder, dietary issue, you will go toward 25 hydroxyvitamin D. That is your answer. If the history is given of weight loss, some like lung finding or cancer finding is given, you will go toward PTHRP. Okay, done. If history is given of sarcoidosis or history is given of, you can say, glycomatous diseases, okay, or history is given of vitamin D toxicity, like that, okay, you will go toward 125. So now I will read these causes. Malignancy is the most important one, but potassium, but calcium level will be more than 14. Other causes given. Here, milk alkali syndrome is very high, okay, and one of the most neglected point. Okay, in milk alkali syndrome, guys, there is a triad. Okay, first of all, history will be given of some stomach burn. Patient will say, I'm having frequent stomach burn. That's why patient will use the antacid. And that antacid will cause Milk-Alkali syndrome. So here, important point is that first you will have, okay, so Milk-Alkali syndrome, okay, first point, most important point is that you will have, you can see guys, you will have renal failure, okay. In renal failure, if you remember, in today's lecture, in renal failure, we have discussed you are having metabolic acidosis. But in this special case, okay, guys, listen to me carefully. Always, when you have renal failure, you will have you will have metabolic acidosis. But this is a very special case of Milk-Alkali syndrome. Here you will have renal failure, but you will have alkalosis in your body. That is a very strange thing. Okay, remember, you will have renal failure, you will have alkalosis, and you can also have stones. Okay, so these are tried. So what is important here? You are having renal failure plus you are having alkalosis. Is that strange? So that is a milk algae syndrome. First, when I encountered that point, I was just shocked.